At any one time, our hospital has over 1,000 clinical studies taking place. But what does health research involve? Some people think of clinical research as patients trying out new medicines. They may worry it is risky and people are just guinea pigs. Some research does involve trying new medications, but at the hospital you are most likely to come across studies involving hundreds or thousands of people. These large trials can only happen after early, small trials have shown the medicine is safe. At these times, doctors will be asking, is this new treatment really better than what we have now? Research can find groundbreaking ways of saving lives when there are no other treatments available. Like gene therapy for incurable diseases, where new genes are added to a patient's cells. Patients, especially if they are very ill, often take part in this kind of trial when there are no other treatments to help them get better. Other research looks at medicines already being used. The advantage is we already know the medicines are safe. Research may be looking at the best time to give the medicine, or whether medicines already being used to treat one disease can treat another. For example, our doctors found that statins, used to lower cholesterol, could help people with multiple sclerosis. And there are other kinds of research, all looking for better ways of diagnosing and treating disease and preventing it in the first place. Researchers may look at scans or other patient information to see if there are any patterns, such as similar results in patients who turned out to have a particular illness. A pattern could suggest a quicker way of diagnosing the illness. Analyzing patient data can help us understand disease, and for a patient, it may simply involve consenting for their information to be used. What we call observational studies can involve extra tests or monitoring, or talking to someone about an illness so researchers can understand how disease progresses. Researchers may develop new tests, like quicker ways of identifying the antibiotic needed to treat infection, or better medical procedures. Our surgeons pioneered robotic surgery to treat prostate cancer without debilitating side effects. Research can be less dramatic, like looking at rehabilitation for stroke. We found intensive rehabilitation, even years after a stroke, could improve function in people's arms. So there are lots of questions researchers are asking, and lots of ways you may be asked to help.